when the first report from the CDC's Morbidity and Mortality Weekly Report reported a very curious situation of 5 men, all gay, from Los Angeles, who were presenting with an unusual pneumonia. It was at that point, 40 years ago, where I can tell you chills went up and down my spine. Being an infectious disease person, I said, oh my goodness, this has to be a brand new infection.
These young men often were in hospitals. We would see them in hospitals very ill, and they had been completely rejected by their families. Sometimes we would call parents and tell parents at the same time that their son was gay and had perished from HIV.
There were no laws protecting people with HIV. So someone could be fired from their job, kicked out of their place of residence, and be on the street within 24 hours of people finding out they were positive.
We're considered miscreants and we're considered uber promiscuous. So it's always a moral Olympics when it comes to Black women in HIV. It's almost as if we did something to warrant getting this diagnosis.
When I began taking care of patients starting in 1981-82, virtually all of my patients died.
This is a very puzzling syndrome, and scientists like myself and others of my colleagues are taking different approaches.
We didn't know what it was, so it was a disease, mysterious, no name yet.
We had only heard one instance when my partner became extremely ill, was on 104 temperature, and we rushed him to the hospital. I had no idea that once they took him back, I would never see him again. Unfortunately, 7 months later, I started running a bad fever. I was originally diagnosed in San Francisco on February the 14th, 1982. So I've been living with the HIV virus at least 39 years, getting ready to hit my 40th year.
One of the things that became very clear is that when you're dealing with a brand new outbreak, an evolving pandemic, that you learn things in real time. It was just literally a matter of several months as you saw injection drug users, hemophiliacs, recipients of blood transfusions, the female sexual partners of men who had this disease, and then finally children born of women who were likely infected.
For anyone out there that has never been in quarantine, it is one of the most lonely, dehumanizing, scary places to be. And I wouldn't wish it on my worst enemy. When I miraculously started getting better, it was about 10 days later. I had a guilt trip for a long time of why I was outliving everyone. It's called survivor's guilt.
You know, the biggest turning point truly was 1996, because that was when we had enough highly active HIV medications that you could put together that you could actually really combat the virus and get the viral load in the body from HIV down to undetectable levels.
We gradually, over a period of years, developed 1, 2, 3, 4, 5, then a combination of highly potent antiretroviral drugs that have literally transformed the lives of persons with HIV.
My name is Lydia Joyce, and I have been living and thriving with the HIV diagnosis for going on, it'll be 5 years in September. The night that I got home, I kept Googling, I'm HIV positive, now what? Like, that was a phrase, I kept Googling, and everything I got was very white, very male, and very gay. As a Black, cisgendered, heterosexual woman diagnosed with HIV, it can be very ostracizing. It can be very polarizing. Your self-worth is attacked. The external stigma then becomes internalized.
When there is discrimination, when there is stigma, it is harder to access services. It's harder to go to a medical center and say, I am gay and I need prevention services. It is more difficult for you to come out with your family, for your family to help support you. So it really is stigma, discrimination, and susceptibility to a pathogen have always gone hand in hand.
Even though we want to say things have progressed within HIV over the last 40 years, there's so many things that have not progressed. You know, the connection to care, the myths, the stereotypes, the stigma, the cost of the medication, the intersectionality of being HIV positive, making sure people have, you know, housing and food, and the same things that they probably were dealing with in the 80s, especially when it comes to minority communities, we're still yet dealing with.
I think the highly productive activism, mostly of the gay community, brought attention to the fact that when you have a disease that appears to be affecting disproportionately a population of people, in this case it was men who have sex with men, that you've got to give them a seat at the table.
I knew I had to speak up, that I couldn't count on someone else doing it, you know, because I was either the first or one of the very first people to get out of the hospital in San Francisco. And if I didn't speak up, then who was going to?
We marched in the streets, we held rallies at state capitals and on DC, we chained ourselves to buildings.
So for 39 years, I've been fighting for something.
In the fall and winter of 1981, there was only a few hundred cases reported in the United States, and now, fast forward 40 years, there have been a total of over 75 million cases worldwide and over 35 million deaths.
Though HIV progress has seemed very quick, in at least over the 40-year span, what we did with COVID-19 in a space of just 7 months, develop highly effective COVID-19 vaccines, to me means that HIV is still a stigmatized condition. And that the rapid progress with COVID-19 needs to be translated into better work on an HIV vaccine.
If we got through and processed what stereotypes and stigmas and myths that people really had, implicit biases, we really could help further the messaging about us really stopping HIV in our lifetime, because it's possible.